Let's talk about that toothpaste because I found that very interesting,
Okay.
right? Because again, you think about nitric oxide, you're going into the supplements, you're talking performance and everything. And here you have both toothpaste, and we'll get into next the skincare system.
Yeah.
But starting with the toothpaste, how do you derive at that formula and what is the main benefit of your toothpaste?
I've been aware of the dangers of fluoride for probably 25, 30 years. And so during that time, I've used a non-fluorinated toothpaste. But there were still things in it that I didn't like, and it was still causing, some but even somebody who's very front and center and aware of my oral hygiene. And so as we progressed in the science and started publishing these papers, identifying these certain bacteria and the ones that were nitric oxide producing, then we had to figure out, okay, what do these bugs need? What do they need to repopulate? What do they not need to create these biofilms in this normal ecology for optimal nitric oxide production? So number one, no fluoride. Number two, we understand how to repopulate these bugs. We put prebiotics in there. And we can't forget this is a toothpaste. And the goal of a toothpaste is to maintain the, tooth remineralization, good healthy teeth, get the plaque off, and maintain a normal healthy microbiome. So it's hydroxyapatite-based, remineralizes the teeth, fluoride-free. We've got prebiotics in there. We put things in there that we're finding that affects these biofilms and creates the proper ecology. But at the same time, you want something that's going to leave your breath feeling fresh and minty. So we put certain oils in there, essential oils that leave the mouth really silky feeling and optimize the pH and normalize the salivary pH. So that was the metric. And for years there was no product out there that I liked. So I go, well, I'll create my own because I understand the science, I understand what these bacteria need, and so we can create a toothpaste. And now, interestingly, we've only had this on the market for a couple of months, but we're finding people that have what's called resistant hypertension, right? Their blood pressure, they have high blood pressure, and it's resistant to standard therapy. And so my whole thought process was we've demonstrated years ago that if you take normal intensive patients, you kill their oral bacteria, their blood pressure goes up. Now, can we do the opposite? Can you take people with oral dysbiosis, their blood pressure is high, restore their oral flora, and normalize their blood pressure? And we're finding, again, this is anecdotal, we haven't done any clinical trials on this, but people have had noticed that their blood pressure becomes more normal when they switch to the toothpaste. So when we target the microbiome, improve nitric oxide production, their blood pressure becomes more normal. And with high blood pressure being the number one driver of cardiovascular disease, the number one killer, I mean, you think about the public health benefits of this and the implications globally. I mean, this is life changing. And now we're working on a mouth rinse that again targets, doesn't kill the oral microbiome, improves the diversity of it. That we'll have on the market probably in first quarter of 2026.
Yeah, you really can't understate the importance of the oral microbiome dental health together, right?
Yeah.
So many issues that you see systemic start in the mouth. And you're just learning. I just rewatched the documentary Root Cause recently. My buddy Fraser who put that together and was about his story. And it's just like one root canal, one
Yeah.
wisdom tooth extraction, oral microbiome, like all these things, fluoride, mercury, are so vital. And that's really, really interesting that you've made that and you've seen such a difference already anecdotally that you just
Yeah.
start to change that opening to the rest of your body, and then everything in the body will change. And we overlook that so much.
Yeah. And then, when people start to understand the importance and pay attention to it, and they eliminate sugar and,
Yes.
and gums and all these things that are destroying the microbiome and lowering the pH, and then they become aware of that and then stop doing it, they can even get better, more profound results. And so, this for us, when people like to see benefits and change and then become more motivated to continue to change, because a lot of times people don't realize how unhealthy and how bad they felt until they start
Right.
feeling better, right? And
That's
they're
right.
thinking, wow, I didn't realize how bad I felt until I started feeling better. And now they're motivated to continue to make changes. It's very simple. It's very small steps, but the progression of this is life changing.
Yeah. And we talk about oral microbiome, but your skin also has a microbiome, right? And that's important as well. And you've created a unique application of NO for anti-aging and skin health. Can you talk about that?
Yeah, the that first came into my mind, and it was never my kind of desire or motivation to become into skincare and beauty. But this idea came back in 2014. My dad, who's a paraplegic from a car accident in 1984, so for 40 something years he's been rolling around in a wheelchair, and developed decubitus pressure ulcers. And in 2014 he had a stage 4 right ischial ulcer that developed osteonecrosis and became septic, and he almost died from it. So once we got him out of the hospital, took him to wound care, and all the wound care clinics said, well, you can never heal this wound in a 60-year-old diabetic paraplegic patient. And I just refused to accept that. So I started creating a nitric oxide generating dressing that I would put into the wound. It killed the infection because nitric oxide is antimicrobial to the pathogens, and it gets blood flow to the wound. In a 4-year-old non-healing wound, we start to see some healing within a matter of a couple of weeks. And then within a matter of 6 or 8 months, we completely healed a 4-year-old non-healing wound by producing nitric oxide. We mobilize stem cells. We use red light therapy. We use ozone. We use a lot of things. But really what moved the needle firstly was the nitric oxide. So then all these wound care docs were like, Nathan, we can't do what you've done. How do we get access to this? And that's why we're developing this as a drug therapy. But, it takes 10 years and about $800 million to bring a drug to market. But to bring a skincare product to market, it's, we did all the safety studies, the sensitivity studies, and we brought a dual chamber nitric oxide serum to market. So these are two separate chambers that when you mix these together, when they come together, they produce nitric oxide gas. And as you mentioned, the skin is an organ, just like the brain, the heart, or the sex organs. And when it doesn't have adequate circulation, it fails. And then you lose hydration, you lose collagen, fine lines and wrinkles show up. You get acne, dermatitis, age spots. So the idea for this was, can we improve nitric oxide production topically, improve perfusion, mobilize stem cells, improve cellular turnover, and improve collagen deposition? And we've got 6 published peer-reviewed clinical trials on the serum, and fine lines and wrinkles, tone, texture, and clarity of the skin, acne, eczema, rosacea, wound remediation, wound healing, scar remediation. I mean, it's been an amazing product. In fact, it's a completely new category in skincare, and it's transforming the health and beauty space. But, I'm excited about that, but I'm more excited about the applications for wound care, because 65,000 Americans die every year in nursing homes from wounds, non-healing wounds that get infected. They get septic and they die. And we haven't seen a wound that we haven't been able to heal with our topical nitric oxide. So I'm really excited about getting that into clinical trials, because it's gonna change the landscape of wound care.
Oh yeah, and we need that. The whole kind of anti-aging field has been sort of stuck in its kind of what's the new chemical we could use that's going to do this, when really we're just raising toxicity in the body. Most women can understand that because they use so many cosmetics now that have so many bad ingredients in them. It's time we start to switch and look at things that can naturally promote health from the body, from the inside out.